Welcome to Sweet Life Beat Life. We hope this video helps.
You find an unresponsive person. You must act now. First, shout for help and have someone call the code team while you open the crash cart. Once done, power up the defibrillator and choose adult or pediatric pads according to patient size. Make sure the chest is bare and dry, shave excessive hair or wipe sweat so pads adhere. Place one pad on the upper right chest and the other on the left lateral chest as shown. Continue monitoring the patient's rhythm. You analyze the rhythm and determine if the rhythm is shockable. If the monitor indicates ventricular fibrillation or pulseless ventricular tachycardia, set the defibrillator to the recommended energy, often 200 joules on biphasic devices, and charge. While charging, verbally ensure everyone is clear of the patient and equipment. Point out hands off. Once charged, say clear, press the shock button, and immediately resume high-quality CPR without delay for 2 minutes, or until the device prompts reanalysis. Keep communicating cadence and cycles to your team. After delivering a shock or when no shock is advised, you must resume CPR immediately, maintaining compressions and ventilation according to protocol. Every 2 minutes, pause only to reassess rhythm and pulse. Continue chest compressions between checks and ensure oxygen and Roman 4 access are maintained. If the defibrillator fails to advise or artifacts occur, troubleshoot quickly. Inspect pad contact, dry the skin, reattach connectors, and replace damaged pads. If pulses return, stabilize airway, monitor rhythm, and prepare for post-resuscitation care.
Thanks for watching. Consider subscribing if we helped you.